Today's Ask the Doctor segment is all about arthritis. Dr. Julian Carlo is an orthopedic surgeon joining us here to answer your questions. Just give us a call at 741-9272. And we already have a caller on the line, Claudette in Hueytown. Claudette, what is your question about arthritis?
Well, I was diagnosed with rheumatoid arthritis back in 1978. And since that time, I've had numerous joint replacement surgeries. And also within the diagnosis of rheumatoid arthritis came a non-specific type of some kind of cancer. It was mimicking it. I have a great rheumatologist, I really do. I am under a rheumatologist. But I'm concerned about the fact when I went to see the oncologist, and he told me that my rheumatoid was so chronic that it was mimicking this cancer, and I know my immune system is compromised just by having the RA. And I'm wondering, like one doctor on one end is saying, well, no, you don't have this non-specific cancer. It's just that your rheumatoid is so chronic where it's mimicking this cancer. And so that kind of puts me in the middle where I'm confused. And like I said, I have a great rheumatologist, and to the best of his ability, he's just saying in a way that you do have rheumatoid severe, but we also found this, and we're going to send you to an oncologist, hematologist. And he just told me, he said, it's mimicking. How can rheumatoid mimic, cancer?
So, Dr. Carlo, how do those two interact?
Well, good question. Rheumatoid arthritis involves your immune system being a bit overactive and leading to inflammation in your joints and then arthritis. I'm a little bit uncertain as to what your rheumatologist was thinking as to why you'd be referred to an oncologist, but it may have something to do with how severe the rheumatoid arthritis is, and the fact that your immune system may need to be modulated in the way that an oncologist would modulate it in order to treat it better.
All right, Claudette, thanks for your question. Our next caller is Lori in Summerton. Lori, your question.
Yeah, I've had rheumatoid arthritis for like 15 years now, and I was being treated by a very good doctor, and I was doing great. And then April of last year, I got sick. Nobody knows how I got it or anything. I wound up with MRSA, and then I wound up in the hospital for 5 months having to have bilateral amputation on both my legs. And now they tell me that I've got to be infection-free completely for 2 years before they can put me back on any arthritis medication due to my immune system. Does that make very much sense? Because I don't understand, because my joints are swelling and they hurt, and the pain medication they give me for my legs and stuff makes me hurt even worse, makes my fingers and stuff hurt worse.
Well, to treat rheumatoid arthritis, we can suppress the immune system, and that can help with some of the symptoms. It seems we may have combating issues here with your own immune system fighting the other infection that you had. So there's always a balance and a trade-off. There's always medications that you can use that may not affect your immune system so much that could help with pain and the inflammation, such as anti-inflammatories or Tylenol, and even narcotic medication. That might be something. I'm sorry you've had such a hard time with those medical conditions.
We've got time for one more question. We have Jan in Gardendale. Jan, your question. Do we still have Jan?
Yes.
Jan, go ahead with your question.
My question is, I've had I've been told I have advanced arthritis in my left knee. I have bone on bone. I have swelling in my knee and leg. My question is there anything possibly can be done short of having a knee replacement? I've been told that's what I need, but I've had a knee replacement in my right knee, but that was about 3 years ago. But I would love to see if there's anything new on the market that possibly could help me short of having the knee replacement.
Yeah. There are a lot of things that you could do besides surgery to help with knee arthritis. So I would say that you can do things such as medication, anti-inflammatories, Tylenol, steroid injections. There are other types of injections that act more as lubricants that could help you. There can be braces, canes, or assistive devices that you could use to help you walk better and help with the pain and function. So there are a lot of other things besides surgery that can help, and you should try those first before considering surgery.
Our thanks to all our callers. Dr. Carlo, just listening to their questions and your answers, there are so many complicated layers when we start talking about arthritis, so certainly people need to speak to their own doctor.
Absolutely, yeah. Consult your own physician when you have questions.
All right. Dr. Carlo, thanks for being with us. We appreciate it. We'll be back in just a moment.